EZC Pak basically is an echinacea zinc vitamin C immune support pack positioned and marketed against inappropriate antibiotic use for colds and flus. So basically our problem in America right now is that we have 2 million drug-resistant infections. We have currently over 40,000 deaths from those infections, and the pace at which these infections are growing is exponential. So currently by 2050, more people will die from drug-resistant infections or superbug infections than cancer. So this is kind of the situation we're dealing with, and part of the problem is that the overuse of antibiotics, especially for common infections that don't require one, has contributed greatly to this problem. Upper respiratory infections, we commonly call these colds or flus. These are the most common infection in humans. So the average person gets between 2 to 4 a year. And it's actually one of the biggest areas of misuse of antibiotics and health expenditures globally. This problem of overusing antibiotics for upper respiratory infections has led to a new era of drug-resistant infections. And we have numerous problems occurring across our healthcare system with what are these called superbugs, which basically are infections that are not amenable to antibiotic therapy, that are basically taking over the healthcare system. So it's a very scary problem. There's a lot happening in terms of loss of life, as well as complex infections requiring basically damage control procedures. So echinacea zinc vitamin C EZC Pak is really positioned against these inappropriate antibiotics that are being written for what amounts to viral illnesses. And as we know, viruses cannot be treated with antibiotics. Antibiotics only treat bacterial infections. However, we're currently writing antibiotic prescriptions at a rate that is causing significant damage to our public health. There was a WebMD study done in 2014. The study found that 95% of prescribers in the US write antibiotics when unclear of the necessity. The number one cited reason, patient expectations. Patient pressure for an antibiotic. Doctor, I'm feeling terrible, I just need to get back to work, I need this antibiotic. This patient pressure has really contributed to the overprescribing and overuse of antibiotics, which is fueling this drug resistance crisis. So basically, in the same WebMD study, they asked, doctor, what do you need? How do you solve this problem when a patient comes in demanding an antibiotic that you don't need? The number one cited request was more tangible solutions for when that patient comes in asking for a specific antibiotic by name. Second request, more education materials to support a patient's understanding between the difference between a virus and a bacteria, and when an antibiotic may be indicated and when consideration of an immune support product may be more viable. EZC Pak is designed as a solution to meet this demand, to support that education process. The concept behind EZC Pak is it's a 5-day tapered immune support pack. So on day 1, the patient is taking a loading dose of EZC Pak and then subsequently tapering it off over 5 days. Now, if during those 5 days the patient is actually getting worse, then there may be an indication at that point to have a return to their doctor's office for a repeat examination. So really the concept behind EZC Pak is creating a safety valve on when you let a patient go out of the office that has a sore throat or has a cough or a sinus issue. So by creating this safety valve kind of system and giving the patient a very directed plan, we are reducing antibiotic prescriptions at initial time of visit to under 5%. At the same time, we're having addressed what the WebMD study doctors are complaining about. I'm concerned about fear of business. I don't want to lose business. I don't want to have negative reviews written about me by patients. And so EZC Pak in this vein has led to an over 90% patient satisfaction rating. So over 90% of EZC Pak users have said they would use the product again or recommend to others. Overall, it's been overwhelmingly positive. This year we won the ECRM Buyer's Choice Award, which is sponsored by Drugstore News in the cough and cold category, which was very exciting. I think it was a form of validation by retail buyers as to the trajectory of the company, which continues to remain on a robust positive growth projection. And I think some of the deals that we've been working on over this course of this Total Store Expo have spoken to the buyer's response to our products. So this fall we'll be doing a larger pilot launch with ShopRite in New Jersey. This will add to our already continued growth in the independent pharmacy channel. We continue to add about 10 stores a week. In the independent pharmacy channel, we're anticipating adding about 30 stores a week as we get into the flu season. As part of that, we will be scaling up nationally with our distribution agreement with Cardinal Health. This is the EZC Pak. EZC Pak is more of a consumer-facing SKU. The 5-day pack is growing at a very healthy clip inside the pharmacy channel and in the health professional medical office world. But how do we extend the line and extend the brand into more consumer-facing outlets? And that was really the genesis behind this EZC Active Pak, which was part of that Buyer's Choice Award this year. And really the concept is bringing innovative packaging with evidence-based, physician-directed OTC support in the form of a retail product that retails for $10. So that's the design. And in here, we solve some of the issues that we're having in the medical community in terms of teaching patients the difference between a virus and a bacteria and when an antibiotic may be indicated and when immune support may be a better choice. This is really the next phase of the company, and consider this product my baby, so to speak. Worked very hard on this. We're very much excited as a team to be bringing this product to market.